Shalom to Dr. Sharon Alroy Preis, the head of the Public Health Services Division of Israel's Health Ministry.
Shalom.
So Israel is in the first place in the world in terms of the vaccination, the coronavirus vaccination. Tell us about this special and amazing operation.
It is an amazing operation. I think it's a cooperation between our HMOs, our hospitals, and the Ministry of Health. And it's really based on the fact that we have a really strong healthcare system. It's not just hospitals. It's really a system that everything is connected, and it's even computerized, so we can get all the data and we can track everything, and we work together really well. So I think this is the reason why we're being so successful in this vaccination campaign.
So how did Israel get it so fast? Is it the Israeli chutzpah?
I think if we look at the healthcare system, we understand that this is the perfect place to provide vaccination to. We have a system that can actually give 150,000 vaccines per day. That's incredible. I don't see any other country that is able to come up with such an operation in such a short time. And so I think they did very smartly in giving us all these vaccines.
Now, on the other hand, the numbers are going up, more cases, more deaths. Why is this happening now?
I think it's a combination of a few things. First, we came out of the previous lockdown in a really high number of 2,000, and we knew this would be risky, and we said, if we go out in a high number, but we go really slowly, and we track the infection rate, and we track the numbers of the pandemic, not by dates in the calendar, but see how the pandemic is going and decide based on that, then we can be safe. And we were safe in the first and second steps, but then the third step, I think there was a reluctance to wait for the right number of the infection rate to go down. And so we start opening, and we know that when you start opening and it's not in relations to the pandemic, then the virus goes wild. And so that is what happened. And I think this, with the combination of people being tired of this pandemic, there is a pandemic fatigue. It's a known fact. And the fact that we have vaccines here, and in addition to that, the English variant that is probably contributing to some extent to the high spread of this pandemic now. I think all of these factors together are where we are tonight.
Now, in terms of the lockdown, it seems much more harder at this time, the third round, for you at the health ministry to initiate a real lockdown in Israel.
It is hard. We can suggest the steps that needs to be taken by our standpoint. And obviously the cabinet is deciding based on broad consideration, not just the healthcare consideration or health consideration. But I think we got to the point where it's really costing in life. So in our opinion, this is the time to really go into a lockdown that will be effective. And when we go out of the lockdown, then we'll be in a better place where more people are vaccinated, and we can use our green passport, which is a combination of people being vaccinated or have been recovered or have tests that are corona tests that shows that they're negative in the period prior to entrance to places. We can go to the next phase of this pandemic and which will be living beside the corona, but living sort of a normal life. But this is not where we are right now. We have 6,000 people who are being diagnosed with corona a day, and we have increased by a threefold the number of severe and critical ill patients in the hospital. We've increased in threefolds the number of mortality each day. So really, it's a kind of a catastrophic status of the pandemic at this moment. And so we really need to do things in order to slow down the spread of this virus at the moment, because the vaccines will take longer time to have an impact here.
Dr. Sharon Alroy Preis, head of the Public Health Services Division of Israel's Health Ministry, thank you very much for joining us, and good luck.
Thank you.